Psychosis can present with a wide variety of signs and symptoms, including delusions, hallucinations, with auditory being the most common, thought disorganization, and agitation. The antipsychotic drugs in this chapter are able to reduce these symptoms in patients suffering from schizophrenia, as well as a variety of other conditions including bipolar disorder, psychotic depression, and drug-induced psychosis. We're going to start with the typical antipsychotics, also known as the first-generation antipsychotics, first developed in the 1950s. This class includes agents like chlorpromazine and haloperidol, your quintessential antipsychotic medications used for decades before the second generation of agents came along. And in this sketch, we're going to enter the realm of art, where we'll meet the quintessential misunderstood genius, Vincent van Gogh, a Dutch post-impressionist painter whose work had far-reaching influence on 20th century art. However, critics largely ignored his work until after his presumed suicide in 1890. In the last few years of his life, he spent his days between the hospital and his home suffering from hallucinations and delusion. The local townspeople called him the red-headed madman. 2 months later, he voluntarily entered an asylum in the province of Saint-Rémy. And it's this very asylum where our sketch begins. It looks like Van Gogh has been quite busy in that hospital room of his, putting together a new collection so that he can finally prove to his critics that he's at least equal to Gauguin. I mean, come on! Just look at his latest masterpiece, Starry Gazing. Those characteristic post-impressionistic halos of light represent the first-generation antipsychotic haloperidol. Also, that zing at the end of gazing should remind you of the zine suffix common to the rest of the first-generation agents, trifluoperazine, flufenazine, chlorpromazine, and thioridazine. There are multiple hypotheses concerning the neurotransmitters involved in schizophrenia. The realization that some hallucinogens like LSD were serotonin agonists gave early researchers a clue of serotonin's role in the development of psychosis. 5-HT2A receptors specifically are important in modulating the release of many excitatory and inhibitory neurotransmitters, and blocking this receptor is a main mechanism of the second-generation antipsychotics. The efficacy of first-generation agents, however, is primarily driven by a blockade of dopaminergic transmission. All antipsychotics block postsynaptic D2 receptors in the CNS, especially in the mesolimbic and striatal frontal system. So, as Van Gogh reveals his latest masterpiece, he grabs onto and yanks down that D2 double dopamine rope. Now, first-generation antipsychotics can be classified as either high or low-potency drugs. The high-potency agents will be illustrated higher in the scene and include haloperidol, embodied by those floating ominous halos, of course, as well as flufenazine and trifluoperazine, personified by this escaped patient here up on the roof of the asylum. Just think of that flu in flufenazine and trifluoperazine as he tries to fly over this cuckoo's nest. High clinical potency means greater D2 receptor binding. So, while these agents are associated with little sedation, weight gain, or anticholinergic activity, they confer a high risk of extrapyramidal side effects, which we're going to illustrate in a bit. Let's sketch in the low-potency first-generation antipsychotics a little lower in the scene. You've got thioridazine represented here by this color theory wheel. Every artist needs one of these. And who can forget chlorpromazine depicted by these ColorPro paints? ColorPro, the #1 name in paints. While these low-potency agents are associated with a lower incidence of extrapyramidal symptoms, it turns out that they have a high histaminic and muscarinic activity with a corresponding increased prevalence of sedation and anticholinergic effects. We'll illustrate these systemic effects in the various paintings Van Gogh has set out for his private exhibition. But first, let's go over the clinical uses of the first-generation antipsychotics. Schizophrenia is the primary indication for antipsychotic drugs. For most patients with schizophrenia, first-generation agents are effective in treating the positive symptoms of the disease, including hallucinations, delusions, and disorganized thought or behavior. However, these same agents are not as effective in treating the negative symptoms of the disease, which include apathy, flat affect, and a lack of energy. Here at Sketchy, we depict the positive and negative symptoms of schizophrenia as positive and negative voices being whispered into a patient's ears. Take a close look at that ear, though, or lack thereof. We all know that story. Gauguin, one of Van Gogh's only friends, decided to go back to Paris after they got in a fight. So Van Gogh did what we would all have done in his situation. He cut off his own ear, wrapped it in paper, and delivered it to a prostitute. Or so he says. As you can see, the positive voices have been blocked by this act of self-harm. However, the first-generation antipsychotics are not as effective in treating negative symptoms, and the negative voices continue. Apparently, Van Gogh had no recollection of these events, and it's plain that he suffered an acute psychotic episode. Acute psychotic episodes, regardless of the underlying medical condition causing the psychosis, are usually managed with antipsychotics. While these agents have been most extensively studied in the treatment of schizophrenia, it turns out that they can effectively treat psychotic symptoms associated with a wide range of conditions, including psychotic mania and bipolar disorder, major depressive disorder with psychotic features, delirium, even psychosis in Parkinson's disease and Alzheimer's disease. Let this acutely psychotic patient running up the acute peak of the asylum remind you of the efficacy of both first and second generation agents in the symptomatic treatment of acute psychosis. Antipsychotics are also used to manage patients during times of acute agitation or aggression. Although not specific to psychosis, untreated psychosis is associated with an increased risk for aggressive behaviors involving an acute state of anxiety, heightened emotional arousal, and increased motor activity. An intramuscular dose of haloperidol, for example, has been used effectively for many years to control violent and agitated patients. Let this agitated patient here, not too keen on sharing the acute peak of the asylum roof, represent this acute agitation. The first-generation antipsychotics fluphenazine and haloperidol have also been used to manage the motor tics associated with Tourette syndrome, though clinical practice has shifted toward the use of other dopamine depleters and alpha-2 blockers. Nevertheless, we've included our recurring symbol for this childhood neurological disorder. Just think of the sporadic motor tics of this Tourette marionette. As a class, first-generation antipsychotics are highly lipophilic as well as highly protein and tissue-bound with large volumes of distribution. These agents therefore take a long time to leave the body. At Sketchy, we represent extended serum half-life with a long tapering flag like this one wielded by our acutely psychotic sanitarium guest. Most first-generation agents have clearance half-lives of 20 to 40 hours, and several have active metabolites, factors that lead to relatively stable serum levels with once daily administration. Although the efficacy of antipsychotics is primarily driven by that D2 receptor blockade, it turns out that these drugs exert blocking actions at numerous other receptors, leading to a wide range of adverse effects. Many of these systemic effects are prominent with the low-potency first-generation antipsychotics chlorpromazine and thioridazine specifically. So we'll depict these side effects here among the paintings created with those vivid chlorpromazine ColorPro paints. Let's start with that Van Gogh classic Cafe Terrace at Night. What the? Some kind of tea party? Wait a minute, that's our Atropine in Wonderland scene. Antimuscarinic activity is prominent with the low-potency agents chlorpromazine and thioridazine. Toxicity results from the inhibition of central and peripheral muscarinic receptors, kind of like how atropine works. This results in dry mouth or constipation and less often in blurred vision or urinary retention. These symptoms tend to be mild or even absent with the higher potency drugs. Okay, now on to the next masterpiece by this misunderstood genius. Noon, rest from work. Nice. Huh. I hate to keep doing this, but you know what this reminds me of? Orthostatic hypotension, another side effect associated with chlorpromazine and thioridazine, likely due to their blockade of alpha-adrenergic receptors. Our recurring symbol for alpha-1 antagonism is an extinguished alpha candle, like this one held by the nurse here who's wondering if Van Gogh has permission to be out of his bed at this hour. Okay, Vincent, you had your fun. Now gimme the ear. Orthostatic hypotension is often accompanied by tachycardia, both of which are common in the first few days of treatment or when the dose is increased. Oh, finally! I've been waiting for this one. Van Gogh's sunflowers! The lower potency antipsychotics chlorpromazine and thioridazine have high levels of H1 histamine receptor antagonism. At Sketchy, histamine is symbolized by allergy-inducing bees like these ones here, oddly attracted to those vivid, lifelike yellows. Antihistamines, as usual, are depicted as a bee swatter. Because of these potent antihistamine effects, chlorpromazine and thioridazine can be highly sedating, though this can come in handy when treating severely agitated, psychotic, or delirious patients in the hospital. Just think of putting your patient to sleep in Van Gogh's sedate and cozy bedroom. At home. That got weird. Sorry. Alright, let's head back up to the rooftop of St. Paul's Asylum, where we're going to focus on the side effects associated with the high-potency antipsychotics haloperidol, fluphenazine, and trifluoperazine. The defining difference between first-generation antipsychotics and the newer second-generation antipsychotics is their high incidence of extrapyramidal symptoms. These symptoms arise due to D2 dopamine blockade in the nigrostriatal tract, which is normally involved in the control of muscle movement. It thereby produces symptoms similar to those seen in Parkinson's disease. So look out for these side effects, including acute dystonia, akathisia, and Parkinsonism in early treatment within hours to days. Among the first-generation antipsychotics, the high-potency drugs such as haloperidol and fluphenazine are associated with the highest risk. So, on top of our fluphenazine patient who's learning to fly, we've included that pyramid-shaped newspaper hat emblazoned with the word extra, our recurring symbol for extrapyramidal symptoms. And I just want to quickly note that D2 antagonism in the nigrostriatal pathway leads to an unbalanced excess of cholinergic activity. Therefore, medications with M1 receptor antagonist properties such as benztropine or the antihistamine diphenhydramine help reestablish the dopaminergic cholinergic balance. Check out our Atropine in Wonderland and Midsummer Night's diphenhydramine sketches for more info on the treatment of extrapyramidal symptoms. Look for that falling pyramidal parking cone. Intrigued by the stories of this prolific painter at St. Paul's Asylum, art connoisseurs from across France have come to see his works in person. And in this sketch, each will represent a specific extrapyramidal effect. As this first observer cocks his head severely to the side, struggling to wrap his mind around Van Gogh's latest work, let it remind you of acute dystonia, an extrapyramidal symptom that can occur within hours of treatment. Acute dystonic reactions are characterized by sudden onset sustained muscle contractions. Depending on the muscle group involved, a patient may present with spasmodic torticollis, like our observer here, oculogyric crisis with forced sustained elevation of the eyes, or even severe arching of the back and neck. These reactions are more common with young males on high-potency first-generation antipsychotics. We all know Van Gogh as the quintessential misunderstood genius. Well, it looks like more negative reviews are coming his way, as our next critic here feels just uncomfortable about the whole situation, knocking over his chair as he backs away in disgust. Let this falling chair represent akathisia, a subjective restlessness with the inability to sit still. Watch out for this extrapyramidal symptom within days of starting antipsychotic therapy. The last critic is way ahead of him and has already begun to climb back into his carriage. Van Gogh? Psh, more like Van Let's Go, because he's bad at painting. Let the massive cogwheels on the carriage remind you of the cogwheel rigidity seen in drug-induced Parkinsonism. This extrapyramidal symptom can occur within days to weeks of initiating therapy. It's characterized by the same symptoms of Parkinson's disease itself, including prominent cogwheel rigidity, bradykinesia, tremor, and masked facies. Remember that although drug-induced Parkinsonism presents like Parkinson's disease, you cannot manage these patients with levodopa. Giving them more dopamine will only precipitate psychosis. You're here to block dopamine, my friend. Instead, use those anti-muscarinic options such as trihexyphenidyl or benztropine. The most important long-term neurological side effects to watch out for in any patients on antipsychotics is tardive dyskinesia. This syndrome is characterized by abnormal chorioathetoid movements, which are involuntary, repetitive, rhythmic movements after months to years of use. Orofacial dyskinesias will present as lip smacking, tongue protrusions, or grimacing, which can be accompanied by movements of the head, limbs, or trunk. The orofacial dyskinesias are represented here by an asylum escapee who grimaces and protrudes his tongue at the critic getting into the carriage. Advanced cases may be irreversible, so it's important to recognize these symptoms early. And, if suspected, lower the antipsychotic dose or switch to a second-generation drug. I want you to recall that there are many dopamine pathways in the CNS, including the tuberoinfundibular system, where the hypothalamus tonically secretes dopamine to inhibit prolactin release from the anterior pituitary. Any drug with a strong affinity for blocking dopamine receptors will block this pathway too, causing hyperprolactinemia. Elevated prolactin levels are depicted here by some elevated milk production, if you will, out of this patient's nostrils as he reacts hysterically to his flying friend. Again, we've placed this patient up on the roof to signify that the high-potency antipsychotics are more likely to cause this side effect. So, when following up on your female patients treated with antipsychotics, look out for the symptoms of hyperprolactinemia, including galactorrhea and breast soreness. In addition, elevated prolactin levels inhibit the release of gonadotropin-releasing hormone from the hypothalamus, resulting in central hypogonadism and amenorrhea. In men, watch out for the loss of libido and impotence. It looks like the inmates of the St. Paul Asylum have a really kooky post-impressionistic party going on up there. You know what I like to eat after I dangle a marionette of a small crying elderly man from the roof of an asylum? Fried chicken, of course! Extra spicy. The label, now more spicy, is our recurring sketchy symbol for the life-threatening disorder that can be caused by any dopamine-blocking agent, neuroleptic malignant syndrome, or NMS. NMS occurs in patients who are extra sensitive to the extrapyramidal side effects of antipsychotic agents. Fittingly, our patient over here holding the chicken seems to be extra sensitive to the antics of his newspaper hat-wearing friend and laughs uncontrollably. NMS is most often seen with high-potency first-generation antipsychotics, and that's why we've taken this fried chicken party up to the roof. Remember, though, every class of antipsychotic drug has been implicated, even the second-generation agents. His other friend, not quite as adept at multitasking while balancing up there, will represent the specific symptoms of NMS. The initial symptom is extreme generalized rigidity, also called lead pipe rigidity, shown here by his rigid arms grabbing onto that pipe for dear life. As he looks at the ground below, he gets a little agitated, hot, undoubtedly sweaty, and I'm definitely sensing some tachycardia up there, perfectly exemplifying the other symptoms of NMS: altered mental status, severe fever, and autonomic instability. Remember, too, that this fried chicken getting munched on represents rhabdomyolysis, which can also accompany this syndrome. So, besides hyperthermia and tachycardia, watch out for elevated muscle-type creatinine kinase while working up these patients. Many of the first-generation antipsychotics are also associated with QT interval prolongation, leading to torsade de pointes or sudden cardiac death. So, if you look closely at the sheet the asylum inmates are using as an escape from a window after curfew, it looks like a twisted streamer, our recurring sketchy symbol for torsades. Also, many of the first-generation antipsychotics can lower the seizure threshold and should be used with caution in combination with other drugs that also increase the risk of seizures. To represent seizure, we have one last asylum patient here rappelling down the asylum wall, but only making it halfway before shaking uncontrollably. Deposits in the cornea and lens are a common side effect of chlorpromazine specifically. From haystacks to halos to sunflowers, Van Gogh's revolutionary use of the color yellow was the defining feature of his life's work. But he didn't just use plain old yellow. His distinctive hue, a long-kept secret, was actually corn yellow. So just think of that special corn yellow ColorPro paint to remind you of the corneal deposits caused by chlorpromazine. Thioridazine, on the other hand, can cause retinal deposits. So next to our color theory wheel, we've placed the artist's palette, which has an uncanny resemblance to a retina. It looks like Van Gogh was in another one of his darker moods, and he's prepared some extra splotches of black paint deposited on that retina palette. Deposits like this may cause browning of the vision, and advanced cases may look like retinitis pigmentosa. Alright, this party's over. Let's sum up this post-impressionistic soiree. The first-generation antipsychotics can be classified as either high or low potency. Those ominous haloperidol halos in that fluphenazine and trifluoperazine flyer are your high-potency drugs, while the chlorpromazine paint and thioridazine color wheel are your low-potency drugs. All antipsychotics block postsynaptic D2 receptors in the CNS. Remember though, when you're treating schizophrenia, first-generation antipsychotics are mainly useful for managing the positive symptoms of the disease. The low-potency first-generation antipsychotics bind D2 receptors less avidly. Instead, they block H1 histamine and alpha-1 and muscarinic receptors to cause a range of systemic side effects, including sedation and hypotension. The high-potency first-generation antipsychotics bind avidly to that D2 receptor. So, up on the roof, we've illustrated the ensuing neurologic side effects. Extrapyramidal side effects include acute dystonia, akathisia, and Parkinsonism. And always be on the lookout for signs of tardive dyskinesia. It might just be hiding in your carriage. Other side effects include hyperprolactinemia and NMS with that classic lead pipe rigidity. What? Bedtime already? Post-Impressionists are such party poopers. Let's head over to Dali's place. Now that guy knows how to throw a party.